All right, so we're diving into something a little different today. And I'm not talking about the kind of diving you do on like a tropical vacation.
Yeah, no scuba gear required for this one.
Exactly. We're going to be taking a deep dive into a recent norovirus outbreak. It happened on the Holland America line's Eurodam, and we're using this CBS News article as our guide.
Ah, yes, the dreaded norovirus. Always seems to be making headlines, especially when it comes to cruise ships.
Right. It's kind of ironic you picture these luxurious cruises, escaping to the Caribbean, all that.
The image of relaxation and indulgence, yeah.
And then, bam, you get hit with a widespread illness outbreak.
It's a stark reminder that those massive vessels, while luxurious, are essentially floating cities.
Yeah, and think about it. You got thousands of people all packed together coming from all over.
A perfect recipe for a contagious illness to spread like wildfire.
And the article doesn't hold back. It really lays out the situation on the Eurodam. Out of over 2,800 passengers and crew,
A significant population, to be sure.
79 passengers and 9 crew members got sick. That's a lot of people.
It really highlights how quickly something like norovirus can spread in that kind of environment. Close quarters, shared facilities.
Yeah, it's not exactly the kind of souvenir you want to bring back from a vacation.
No, not at all. And when we talk about norovirus, we're talking about those classic symptoms. Vomiting, diarrhea,
It can really knock you down.
absolutely. And the thing about norovirus is it's highly contagious. It can linger on surfaces for a long time.
So even if you think a surface looks clean,
It could still harbor the virus. And what's even trickier, people can still be contagious even after they start feeling better.
oh wow, so you might think you're in the clear, but
You could still be spreading it without knowing.
see, this is what I mean about cruise ships being kind of like,
Big knowledge for these types of viruses.
Exactly.
It's like a petri dish, almost.
But here's the thing, this Eurodam outbreak, it's not an isolated incident, right?
Right, the article points to a bigger trend. Norovirus cases are surging across the U.S. this year.
Really, like all over.
Yeah, it's not just a cruise ship thing. Numbers have doubled compared to last year.
Wow, so it's happening everywhere.
It seems like it.
Yeah.
We'll dive into the reasons for that surge later, but
Okay, so there's a lot to unpack here.
definitely.
But before we get into all that, I'm curious about those other outbreaks the article mentioned. Like there was one on the Rotterdam, also a Holland America ship.
Right, and that was just earlier in February.
And then there's the CDC's Vessel Sanitation Program. They've investigated 3 other outbreaks on cruise ships already this year.
That's right. It makes you wonder about the preventative measures in place. What's being done,
Yeah, like what is this Vessel Sanitation Program anyway? Do they have any real power?
Well, the VSP, it's actually part of the CDC. Their job is to prevent and control these types of illnesses on cruise ships that sail in U.S. waters.
So they're like the cruise ship health inspectors.
Yeah, you could say that. They do inspections, investigate outbreaks. They even give recommendations to the cruise lines on how to, keep things clean and sanitary.
Okay, so they're keeping an eye on things. But what happened on the Eurodam once the outbreak hit?
Well, the article says they took action right away. Increased cleaning and disinfection, started isolating sick passengers and crew, even started collecting stool samples for testing.
Stool samples. Ew.
I know, not the most pleasant image. But it's crucial for confirming the presence of norovirus,
Mm-hmm.
and it helps rule out any other possible causes.
So it's not just about treating the sick people. It's about understanding the virus itself.
Exactly. You need to know what you're dealing with to fight it effectively.
Okay, that makes sense. But before we get too deep into the world of norovirus, I have a more basic question. Why are cruise ships so susceptible to these outbreaks in the first place?
Ah, that's a great question. And it's something we should definitely unpack. So yeah, why are cruise ships so susceptible? It really comes down to a few key factors.
Okay, lay it on me.
Well, first off, you got close quarters. Like we were saying before, thousands of people in a relatively confined space.
Right.
And these people are coming from all over the place, bringing their own, their own germs and whatnot.
They're our own little microbiome party.
Exactly. And all those microbiomes are mixing and mingling. It creates like a perfect breeding ground for contagious illnesses, especially something like norovirus, which spreads so easily through contact.
So it's not just about being close to someone who's sick.
No, it's about touching surfaces that someone sick might have touched. Door handles, railings, you name it.
Okay, so close quarters, lots of people, shared surfaces. Anything else?
Oh yeah, there's more. Think about the dining situation on a cruise ship.
Oh yeah, the buffets. All you can eat, all day long.
Exactly. You've got all these people serving themselves from the same dishes using the same utensils. It's another opportunity for the virus to spread.
So even if the food itself is prepared safely, it can still get contaminated.
Right. And then, there's also the whole issue of changing environments. People are coming and going all the time, bringing new germs with them.
Yeah, it's like a revolving door of potential illness.
It really is. And all these factors combined make it incredibly difficult to prevent outbreaks, even with the best hygiene practices in place.
Speaking of hygiene, I'm curious about what the cruise lines are doing to combat norovirus. Like, beyond the usual hand washing reminders, are there any high-tech solutions out there?
Well, some cruise lines are starting to use UV light disinfection systems, ultraviolet light.
Oh, like those black lights they use in nightclubs?
Kind of, but these are specifically designed to kill germs. They use them in high-traffic areas like dining rooms and elevators, and even in the cabins.
Wow, that sounds pretty effective.
Yeah, UV light disrupts the DNA of microorganisms, basically making them inactive.
So it's not just cleaning, it's like sterilizing.
Exactly. And then there's electrostatic spraying, which is another cool technology.
Electrostatic spraying, what's that?
So it uses these electrically charged particles to coat surfaces with disinfectant.
Oh, so it's like a more efficient way to disinfect.
Yeah, the charged particles are attracted to surfaces, so they coat them more evenly and thoroughly. And they can even get into those nooks and crannies that are hard to reach with traditional cleaning methods.
Okay, so UV light, electrostatic spraying. What about food safety? I mean, that seems like a major concern with norovirus.
Oh, absolutely. Cruise lines are putting a lot of emphasis on food safety these days. Strict guidelines for handling, preparation, storage, the whole 9 yards.
I guess it only takes one contaminated ingredient to ruin everyone's day.
Right. And they're also focusing more on passenger education. Informing people about norovirus, how it spreads, how to prevent it.
So it's not just about the cruise lines doing their part, it's about passengers taking responsibility too.
Exactly. It's a shared responsibility, really. Everyone needs to be on board, so to speak.
I see what you did there. But even with all these precautions, outbreaks still happen. So what happens when norovirus does manage to slip through the cracks?
Well, that's when a good outbreak response plan is crucial. And the VSP, that Vessel Sanitation Program we talked about, they work with cruise lines to develop these plans.
So they're not just inspectors, they're like consultants too.
In a way, yeah.
Yeah.
They help the cruise lines figure out what to do if an outbreak happens.
Okay, so what does an outbreak response plan look like?
Well, the first priority is to quickly identify and isolate anyone who's sick. Most ships have designated isolation cabins for this purpose.
Makes sense. Get them away from everyone else to prevent further spread.
Right. And then they go into full-on cleaning and disinfection mode. All those high-tech solutions we talked about, they put them to work. UV light, electrostatic spraying, the whole shebang.
So it's like an all-out war on the virus.
Pretty much. And they also ramp up the cleaning frequency.
Yeah.
Surfaces are disinfected multiple times a day, and cleaning staff wear protective gear to minimize their own risk.
Wow, so it's a massive coordinated effort.
It really is. And it's not just about containing the outbreak. They also want to gather as much information as possible about the virus itself.
Right, like with those stool samples.
Exactly. They analyze the samples to identify the specific strain of norovirus, track its origins, all that.
So it's like detective work for viruses.
You could say that. And all this information helps them refine their prevention strategies and prepare for future outbreaks.
Okay, so we've talked a lot about what the cruise lines are doing. But what about us, the passengers? What can we do to protect ourselves? Besides washing our hands, of course.
Well, hand washing is definitely key. But you also want to be mindful of those high-touch surfaces we talked about. Use hand sanitizer after touching elevator buttons, railings, things like that.
Okay, good to know. What about food? Any tips for navigating those buffets safely?
Sure. First off, make sure the food you're choosing is cooked thoroughly. Avoid anything raw or undercooked, especially seafood.
No sushi for me, then.
Probably a good idea. And be mindful of cross-contamination. Use different utensils for different dishes. Don't use the same tongs for the salad and the chicken, for example.
Right. And wash your hands before and after eating.
Always a good idea. And finally, if you do start feeling sick, don't try to tough it out. Report it to the ship's medical staff right away.
Yeah, better safe than sorry. And I guess that same advice applies even when we're not on a cruise, right?
Absolutely. Especially with this national surge in norovirus cases we're seeing.
Right, that was one of the things we wanted to dive into. So what's causing this surge, and what does it mean for us beyond the world of cruise ships?
Well, it seems like the pandemic might have played a role. All those lockdowns and social distancing measures. They probably suppressed the spread of norovirus for a while.
So it's like the virus was on a forced vacation and now it's back with a vengeance.
Kind of, yeah. Now that things are back to normal, people are interacting more, traveling more, maybe not being as diligent about hygiene, and that creates a perfect environment for norovirus to make a comeback.
So it's a combination of behavioral changes and maybe a bit of viral opportunism.
Right. But there's also the fact that norovirus is constantly evolving. New strains are emerging all the time.
So it's not just about us letting our guard down, it's about the virus itself getting better at spreading.
Exactly. And some of these new strains might be more transmissible or even more resistant to disinfectants.
Okay, that's a little bit worrying. So what does this surge mean for us on a broader scale? Like, what are the implications for public health?
That's a big question. And it takes us beyond those headlines about cruise ship outbreaks and into the wider world.
Yeah, so we've got this surge, and it really brings up the question of what it means for public health overall. It's not just about a few days of feeling awful, right?
Right. I mean, we've all heard about those cruise ship outbreaks. But how serious is norovirus really?
Well, for most healthy people, it's not usually life-threatening. You get sick, you feel miserable for a few days, and then you recover.
Okay, so like a really bad stomach bug.
Yeah, basically. But there are some groups that need to be more careful, like young children, older adults, people with weaker immune systems.
Right, those who are more vulnerable.
Exactly. For them, norovirus can lead to more serious problems. Like what kinds of problems?
Well, one of the biggest concerns is dehydration. All that vomiting and diarrhea, it can really take a toll on your body.
Yeah, you lose a lot of fluids.
Right. And that can be especially dangerous for those vulnerable groups we talked about. They can get dehydrated much faster.
So it's not just about feeling sick, it's about the potential for complications.
Exactly. In some cases, people might even need to go to the hospital to get rehydrated.
Wow, I didn't realize it could be that serious.
Yeah, it's important to take it seriously. And it's not just about individual health either.
What do you mean?
Well, think about what happens when a lot of people get sick at the same time. Schools might have to close. Businesses might have employees out sick.
Right, it can disrupt everything.
Exactly. It can put a real strain on communities and even the healthcare system.
So it's kind of a ripple effect. What starts as a simple stomach bug can turn into a much bigger problem.
That's a good way to put it. And it really underscores the need for a multi-pronged approach to dealing with norovirus.
Okay, so we need to attack it from all angles.
Right. It's not just about individual responsibility, although that's obviously important. We need community-level interventions and strong public health initiatives.
All right, so break it down for me. What are some of these community-level interventions?
Well, one crucial thing is ensuring access to clean water and proper sanitation. That might seem obvious, but
Yeah, you'd think everyone would have that, but
you'd be surprised. Even in developed countries, there are communities that struggle with these basic needs.
like, whoa.
Well, homeless populations, for one. And sometimes rural communities face challenges with water and sanitation infrastructure. Even temporary settings like music festivals or big sporting events.
Right, places where a lot of people gather.
Exactly. And if those basic needs aren't met, it's much easier for a virus like norovirus to spread.
Okay, that makes sense. What else can be done at the community level?
Another big thing is promoting good food handling practices. We need to make sure restaurants are following proper hygiene guidelines.
Right, like washing their hands, storing food properly, all that.
Exactly. And we need to educate the public about safe food handling at home, too. Things like washing your hands before preparing food, cooking food thoroughly.
No more 5-second roll then.
Probably a good idea to ditch that rule altogether.
Okay, so we've got clean water, safe food handling. What about those public health initiatives you mentioned?
Well, public health agencies play a vital role in tracking norovirus outbreaks, identifying new strains, and developing prevention strategies.
So they're kind of like the virus detectives.
You could say that. They're constantly monitoring the situation, gathering data, and figuring out how to stay ahead of the virus.
So it's like a constant arms race between the virus and the scientists.
Kind of, yeah. And they're also doing research into potential vaccines and antiviral treatments for norovirus.
Wait, there's no vaccine for norovirus?
Not yet. It's been a tough one to crack, mainly because there are so many different strains of the virus.
So it's like trying to hit a moving target.
Exactly. But there are some promising vaccine candidates in the pipeline.
So there's hope for the future.
Definitely. And in the meantime, we have to rely on those proven prevention strategies and a strong public health system to keep things under control.
It's amazing how we started with a cruise ship outbreak and ended up talking about global public health.
It just shows how interconnected these things are.
Well, we've covered a lot of ground today, from the nitty-gritty of norovirus symptoms to the broader implications for society. It's been quite a journey.
It really has. And it just goes to show that even a seemingly simple stomach bug can have far-reaching consequences.
Absolutely. Well, that about wraps things up for this deep dive. Thanks for joining us, and until next time, stay curious, stay informed, and most importantly, stay healthy.